You're listening to the Sick and Good podcast. My name is Dustin Messick, RDN. I'm a cancer survivor.
My name is Dr. Colin Goodwin, and I'm a cancer survivor. We're discussing topics related to cancer treatment and recovery while promoting wellness.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment, and before undertaking a new healthcare regimen.
Thank you for joining us for the Sick and Good podcast. Join the conversation. We have Amy Shapton with us. Amy has a Master's of Health and Military Social Work with 9 years of experience at the SANCEP Clinic, working at the Ridley Tree Cancer Center in Santa Barbara as the Program Manager of the Oncology Social Work Services. Welcome, Amy. Thanks for joining us.
Thank you guys for having me. It's good to hear from you both.
Yeah. So, Amy, can you tell us a little bit about what got you interested in social work?
Absolutely. So I've always been drawn to people and kind of understanding their personalities and their history and their behavior. So that would be kind of what started my interest in getting involved in social work. When I was growing up in high school, I was part of some different outreach programs like Young Life, and we did a lot of community outreach to different places. I think going out to like Mexico and building houses for people and really just getting into the community there was something that stayed with me. And that's kind of what started this journey for me. My father, when I was 16, was diagnosed with cancer. He was diagnosed with periangiosarcoma and had a 6-year battle with that. So I really understood the impact that cancer has on the family system and started to get a real sense of appreciation for the people that supported him and our family, like the medical team, the social workers, the nutritionists, the hospice workers, just how everybody came together to fiercely advocate for him and our family. And once I accepted that I didn't have the math skills to go into marine biology, then I decided to go into human services. I got my bachelor's in human services and went on to get my master's in health and military social work.
That's awesome. Thanks so much for sharing that. It certainly sounds like there's that personal understanding of what the impact of cancer has on a family unit. And that sounds like it's really been a driving force for your own personal work.
I think it's really helped me to be able to empathize on a deeper level with the population that I work with. And it's not an easy thing to share with people, but it's definitely part of my story and helps me with my work. So.
Well, we'd love to hear about your work at the Ridley Tree Cancer Center. Can you tell us about some of the community outreach that you've done?
Yeah, so it's really a joint effort. So my team and I, we try, especially during COVID, is just to keep our presence out there in the community and try to reach a wider audience, especially people being isolated at home. So we worked with marketing at SANCEP Clinic to get some community lectures out there. In the fall, we put out as a team a lecture on using cognitive behavioral therapy to address unhelpful thoughts that come up while you're going through cancer, which was really fun to do with my social workers. And there was a good response out in the community. We also have done some different recordings on our website, on Ridley Tree's website, for people to access anytime, having access to some different evidence-based stress-reducing techniques like progressive muscle relaxation, guided imagery, some of these kinds of different relaxation techniques that can be really grounding. We're in the process in 2022 in the spring where I'm going to be working on a new community lecture on survivorship. So those are some of the community outreach things that we've had going on over the last few months.
That's interesting. Like, I wonder how much of that is kind of that pivot to then the pandemic. Makes me wonder if some of those resources would be more in-house and rather than having them recorded on the website.
Oh, absolutely. I think switching over, like if we're focusing on the impact of the pandemic, once COVID came about, we had to quickly transition to working from home and not seeing our patients face to face anymore, just trying to protect this population who are extremely at risk with the compromised immune systems. And so we quickly learned how to use Zoom and turn all of our support groups into Zoom and into a Zoom platform, doing counseling via Zoom or teletherapy. So it's definitely, I think there's been positives and obviously negatives with everything that's gone on with having to make those transitions. There's been just a huge increase in a need for more support for people's mental health, I'd say, during the pandemic. And so we've definitely been very busy. But it's been nice to be able to have these mediums for doing support. I mean, I personally have a cancer patient that ended up moving to Japan. And so I'm able to do counseling with her over Zoom while she's over in Japan getting treatment over there. And there's those kind of positives, being able to, like, people that live out more rurally are able to log in and be part of a community support group. So I try to look at the positives and things as well.
Yeah, I think as being a mental health provider, I've definitely seen that pivot to having more telehealth services offered and really how that has increased access to mental health treatment and services.
Absolutely.
Well, I want to ask about some specific resources that the Ridley Tree Cancer Center offers to cancer patients. Oh, I guess I could make that more general questions if you could just tell us about the resources.
Yeah. So specifically our social work department, we try to get patients connected when they're starting their treatment and making sure we're completing biopsychosocial assessments, distress screenings, trying to identify any stressors that are happening, whether it's regards to practical, emotional, or physical factors. And so from there, we work with our team of social workers and caseworkers and administrative assistants to get people connected to transportation assistance, to getting food delivered to their house, maybe getting them connected to outside agencies that also provide support, and I can mention those a little bit later, and then also obviously we provide counseling, relaxation, support groups, financial assistance, really we try to access whatever resources are needed at the time, whether it's getting just some durable medical equipment like a walker or getting groceries at one of the Unity shop in town. We just try to, anything that we can help people with while they're going through this, just to make their treatment easier is really the goal of our department.
It sounds really rewarding to be able to provide so many resources to your patients.
It is really rewarding. I wish there's still our needs that we're unable to fully meet, but I mean, we do our best. We do our best in every situation to help.
Okay. Can you tell us about your role in the oncology social work services?
Yeah. So I'm a licensed clinical social worker. So a big part of what I do is the social work with patients. Like I said, doing counseling and connecting to resources, doing grant writing, getting funds to cover their medical treatments. And then I'm also the program manager. So I manage our team of social workers. We have 4 of us social workers, 1 bilingual social worker. We have 3 caseworkers who are amazing and help support the social workers and the patients, and our administrative assistant. who helps with a lot of behind the scenes and getting patients enrolled into copay assistance programs to help cover their medical treatment. We have a gentleman who helps facilitate our prostate cancer support group, and also have him on hand for patients that, really would prefer to have a male, because all of our social workers right now are female. So we like to have that ability to support patients. Did that answer your question?
Yeah, I think that did.
It sounds like you're not doing enough, is what I'm saying.
Yeah, I'm not that busy. So
It sounds really chill. Like you must be spend a lot of time just in the break room watching TV.
Yeah, lots of downtime in there.
That would be funny.
Yeah, I don't think a lot of patients really know what social workers do. I mean, from when I was a patient, I wasn't really explained. The social worker would just show up and just say, "Hey, are they feeding you? Are they? Do you feel like you are being mistreated?" And I would just be like, "Who is this person? Like, are they a nurse? Oh, they're not wearing a white coat. Sure, yeah, I think they're treating me all right."
Well, that's good. I'm glad they were watching out for you. So, but
yeah, are they not watching out for others?
I think I think we try to act as a safety net, just to help support patients through this whole process. This is one of the hardest things that a person goes through, is, as you guys know, cancer diagnosis, treatment, and the impacts that has on your life. So obviously we can't control that medical piece whatsoever, but if we can instill a little bit of hope and joy and some levity, that's kind of like that's what I try to do, and try to remove those stressors, those barriers to getting through treatment. That's all I can do. That's all that we can do.
That all sounds like amazing stuff.
Yeah, I was just going to say,
yeah,
providing like, joy and levity.
What do the doctors do? It sounds like the social workers are where it's at. And I think since the doctors have white jackets, maybe the social workers should wear like gold jackets or like rainbow jackets, so everybody knows who they are.
Yeah,
so they know that they've won the golf tournament.
Oh, that's
yeah, the gold. Where's your gold jacket, Shooter McGavin?
And I have to say this, the social workers, I mean, obviously, I think that we do amazing work, but we work with, it's really a community. It's a team effort. Like, it's the doctors, the nutritionists, the navigators, the genetic counselors, people in research, the nurses, the nurse practitioners, the physician assistants, the patient service representatives, like everybody, we all work together to get patients through their treatment. And so it's definitely a team effort, I would say.
Yeah, the integrated approach. And what I'm really hearing is that the whole body approach.
Yep. And even, outside of Ridley Tree, we work so close with different community agencies like Cottage Hospital, the social work department over there, the financial assistance over there, Hospice of Santa Barbara, getting food to patients through like Food from the Heart, Organic Soup Kitchen. I mean, I could go on and on listing the people that help on a community macro level. So
yeah, I was going to ask about some of those community resources. You said that you could speak to that. I wanted to see if there's anything else you wanted to add as far as assistance programs or anything that you feel would be kind of just helpful.
Sure.
Include.
Yeah. So, I mean, obviously, we couldn't do anything without the support of the Cancer Foundation of Santa Barbara and the funds and the generous donors that contribute to our salaries as well as to assistance for patients. Same goes for Sansom Clinic. Both Ridley Tree and Sansom has access to charity funds, patient assistance funds for patients that are unable to afford or struggle financially with paying for their medical treatment. So we're able to use those in-house funds to help get them through. There's also, am I jumping into financial resources right now? Sorry.
Sure, if you'd like to. I'm certainly happy to have you take the lead.
Okay. So we also work with getting financial assistance for patients, because a huge part of an impact of going through this is not being able to work and the financial hardship that results from that, sometimes financial devastation. So we're able to work with some local foundations like the Cecilia Fund to help with medical expenses, Jefferson Foundation. They help us pay for patients' rent. Bloom Again is a strategic partner, and they have been instrumental in helping some of our female patients that have been impacted by a cancer diagnosis and unable to work, helping with like multiple months of rental assistance. Again, there's like so many. I will leave out so many if I try to name them. So I'm just going to thank them all. But we also, a big piece of what we do is the cost of cancer treatment itself is really the medications. Some of the medications aren't covered by insurance. And so the social workers, we work on obtaining copay assistance funds and free drug funds through the manufacturers. On a yearly basis, we secure multi-million dollars in funds for patients. So it's pretty phenomenal.
I think that is quite the comprehensive list of assistance programs in the county and that local area. Thank you very much for sharing those. The thing I was wanting to ask is if there are specific barriers for the population that you serve, or if there's perhaps adjustments that you've made to that specific population.
Absolutely. I think some of the barriers for patients, especially there's a large majority of undocumented workers and people here in Santa Barbara. And so some of these patients don't have insurance or are working jobs that they don't have access to things like state disability or social security disability to help supplement their income. So I think a barrier is not having health insurance. One thing that's a challenge that I see pop up for our team is if somebody who's undocumented, they're in the process of becoming a citizen and they're trying to get access to healthcare like Medi-Cal, that can prevent them from becoming a citizen. Also, like if there's a program called PruCall, which is for undocumented persons. And if you sign up for PruCall, it can give you full scope medical insurance. But there's a risk to that. You have to sign off on, there's a chance that, you could be deported. So people are having to face leaving their families for getting healthcare. And so I think that's a huge barrier. And I don't have a solution for that, but our goal is to, get people the care that they need. And so, yeah, but that's a big challenge. I think another barrier is just the cost of living in this community. I mean, you can be making a pretty decent living, but it usually just all goes to your cost of living. And so if somebody is unable to work, that can be, as I mentioned, financially devastating.
Yeah.
So, and I try to help navigate that with patients as they go through this and try to connect them with resources that can help.
From hearing about all these barriers, I'm curious, is there a particular case that you were the most proud of being a part of?
Ooh, that's throwing a curveball for me.
Curveball.
There's been so many cases where we've been able to just get people insurance, get them grants, get them connected to different resources, getting them like a dream grant. One case I had a couple years back, which was pretty awesome. Obviously, I can't mention any names, but this was a really young woman with colon cancer, but a very young family, and they lacked insurance and lacked support, and we were able to get them all of those things, and we're able to help facilitate them going to Hawaii before she passed away. So there's there's a lot of those stories. I'd say there's a lot of I think there's that stigma around cancer, as you guys know, that it's like, whenever I mention that I work for oncology, people are like, "Ooh, that's really sad and really hard." But there's so much more positive that I personally take away from it that makes working through those barriers meaningful. So I hope that answered your question. I went a little bit off.
Yeah, no. Thank you for sharing all of that. I mean, the positives outweigh the negative.
Yeah. That's kind of how I approach this, and that's what I try to do with patients. So,
and I think what you were maybe referring to is that stigma that there's a cancer diagnosis is a death sentence, and that having just even that label or diagnosis means that it will be terminal. That was something that I had come across where I had someone that I grew up with ask my brother if I had died yet.
Yeah.
And there's just that kind of just misunderstanding of what that means. And it I'm hoping is something that hasn't been as prevalent. I was obviously treated almost 20 years ago now. I'm not going to age myself at all. Aging myself. But with the advances in cancer treatment, I think that, I would hope that there isn't that same stigmatized thought process or that same kind of misconception.
Yeah.
Is that something that you still deal with that you were kind of like referring to? I just wanted to maybe make sure I was on point there.
Oh, no, absolutely. I think when somebody gets a cancer diagnosis, it's just like life shattering because there's still that stigma there. And if you haven't known somebody that's gone through it, or it hasn't really impacted your life in a close way, it's extremely scary. And so just trying to educate people and to encourage them not to do too much information seeking online, tell them to talk to their doctors and have faith in their doctors. Because a lot of these treatments have come such a long way. The side effects aren't as bad. Not saying that there aren't any side effects, because obviously everybody's different. But I think treatments have come a long way, and people are living with cancer longer than they ever have, and going into remission. Just celebrated a dear patient's birthday, and she's in a remission-like state. So there's a lot of those stories. I think another, kind of backtracking a little bit, are the cultural stereotypes, cultural norms that also kind of have an influence on how people deal with cancer as well. I think that's something that we have to be mindful of and respect in order for us to build that rapport with patients.
Certainly. One thing I was hearing is that recommendation not to do like the lazy boy doctor. I don't know if that's an actual term, but just to look at WebMD, my field, I think some things that's come up is that social media, relying on, even TikToks to get some information based off of medical care.
Yeah. Absolutely. I try to point people in a direction they're going to get helpful information, because having information is vital. But yeah, there's a lot of misinformation out there, and Dr. Google will most definitely
Dr.
any
Google,
side
exactly.
effects you have is you definitely have cancer. I mean, and we're all guilty of doing it, but it can have an impact on everything. So being mindful of that is important.
Yeah, I can kind of relate to, I think, some of that thought process for patients is you're just feeling like a moment of doubt. So you're like, oh, maybe Dr. Google's got an answer for me. And unfortunately, Google doesn't filter like humans do. Like, oh, you have this.
Yeah.
Google just vomits every single occurrence of whatever you're looking for. And it is too much.
Yeah.
Can certainly be overwhelming, right?
Yeah, you have diabetes, cancer, renal failure. You're also your organs, your lungs are possibly collapsing, and you have your nerves are falling out. You're just oh my god, all these things are happening to me. What?
Game over, man. Game over.
Yeah. I mean, like going down that rabbit hole, that kind of like catastrophic way of thinking can just set you straight into panic. So I think especially for people that are dealing with anxiety, it's trying to use some grounding techniques in those moments, or when you're start to go down that path, can be really helpful in stopping that.
And I think going full circle, it makes me think of just those then resources that you have had kind of pivoted to online resources and the progressive muscle relaxation and some positive images.
Mm-hmm. Guided imagery. Yep.
Yeah, exactly.
I just thought of like one like last question.
Yeah.
Maybe we already covered it, but I was thinking like, what does a social worker do from like day to day? Like what is like a moment to moment? Because I'm wondering if any of our listeners from the start were like, what does a social worker even do? I heard Obama was a social worker, but like, what is it that they do? Do they just talk to a lot of people?
We like from in a day-to-day basis, I can speak for my team and we're doing counseling. Between counseling, we are following up on referrals for patients that are struggling emotionally. If they're needing they don't have transportation to get to their medical appointments, we're calling them to help resolve that. If they're unable to afford their rent, we're doing a full assessment and seeing what resources are available for them and getting them connected with that. If they need to go on medical leave and they need their state disability paperwork filled out, the social workers are filling all that out, getting it signed by the doctor, getting it mailed in, calling to check the status of it. We're doing somebody's drug, their potentially life-saving medication isn't covered by their insurance and it's $10,000 a month. We are applying for free drug through the pharmaceutical company, tracking that all the way till it's approved, getting the medications delivered to the patients, to the facility so it can be administered. I mean, the list kind of goes on, and I say this like this never ends. It's a constant flow of needs of patients. So we get sometimes multiple of the same kind of referrals in a day, and sometimes they're completely different. So, but definitely,
okay.
Yeah.
Yeah, I have two follow-up questions on that. One being, do social workers ever work freelance?
Do we? Yeah. I mean, we don't, but I think there's, especially with this kind of surge and need of telemental therapy, there's a lot more social workers being kind of recruited to do counseling just to meet the needs of all of these, like these remote needs. Does that answer your question?
Yeah, I think so. I was thinking,
Freelance.
my mom was saying years ago, there needs to be somebody who does all of what you're saying, who helps patients who are outpatient. And I was like, yeah, it's weird that there's nothing like that. But an inpatient person has a social worker, but an outpatient person.
Okay, that thanks for clarifying that. So at Ridley Tree, we are an outpatient program, and we help anybody that has cancer. So anybody in the community, they don't have to be a patient at Ridley Tree. They can be a patient at UCLA. They can be a patient at City of Hope, wherever it is. We help anybody that has cancer in the community. So in the sense, we are freelancing. But yeah, I hope that addresses that piece.
Okay. And my other question was, when you do counseling with your clients or your patients, what usually is a counseling session like? Is it just like trying to help them emotionally with like handling their situation, or like with finding their resources that they need?
Yeah, that can also depend on the day. All of our social workers are trained in using cognitive behavioral therapy to address things like depression, anxiety, pain, insomnia. And so these are all real common themes that come up while you're going through cancer treatment. And so you just meet the patient where they're at and what their needs are that day. Sometimes, like I told you guys, I had laryngitis a couple weeks ago, and I still did counseling with patients, and I was just there on Zoom listening because they needed to talk. So just being there for people to support them is really, we're constantly kind of shifting to meet the need of the patient in their moment.
I really like how you described the social work department as that safety net. And one other thing I was kind of thinking of as I was just hearing all the things that you do on a day-to-day basis is it's almost like a flight navigator. Or not the flight navigator. What's the term I want to use here? It's like the flight control tower, right?
Control tower.
Yeah, you're really making sure that everything goes smoothly, that everything's landing, and that you have that eyes on the skies and that bigger picture.
I think we try.
That's a great analogy, Colin.
That is great. I think we definitely try. We definitely don't always succeed. I mean, I think one barrier that I mentioned earlier, that I didn't mention earlier, is just like the prevalence of homelessness and cancer, and people coming to us that are really needing money for a hotel or money for trying to help get people into housing quicker. And a lot of those things, we don't have enough resources. We try to work with the community and the other community social workers to advocate for patients. But there's a lot that we do. There's a lot that we are unable to do. So I say, we do amazing work, but there's still stuff that's a challenge for us as well.
Yeah, I'm hearing there's certain times when you want to be able to do more, want to be able to help more, but there's those limitations or perhaps even barriers to that care, like you were saying, that the homelessness in particular in Santa Barbara County, and having that be a particularly difficult than perhaps social problem that arises that makes cancer treatment and services so hard to connect.
Yeah. Not to end on a negative note, but yes, it's an issue. Like I said, I think it's important for people, no matter what, while they're going through their treatment, is to keep living life. Mm-hmm. I say this a lot to patients, that this is a chapter in your story. This is not your whole life book. And not for everybody, but for the majority of patients, I feel like there's a lot of post-traumatic growth that happens through this experience. So
I love that. This is just a chapter in your life, your whole life book. That's like I think I might steal that for some of my clients.
It also reminds me of that quote from The Shawshank Redemption, where Red says, get busy living or get busy dying.
Yeah. Yeah.
Wow.
How about that for a last note, huh?
Oh yeah, that's it. That's it right there.
Thank you guys for having me. It's been fun to chat with you both, and appreciate the work that you're doing for this community, and happy to collaborate again in the future.
Thank you so much for speaking with us, Amy, and sharing your expertise and your perspective on the work that you're doing in Santa Barbara.
Thank you so much.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey.